and just veg out for the day. Um, in your opinion, or do you have like, again, this is not medical advice. This is just two doctors talking. This is the disclaimer here, but like, are there things that people should be mindful of in terms of like, um, if they feel really massive discomfort or like they see bleeding or like are there things where that you should definitely call their IVF coordinator nurse or their doctor immediately?
Yes, of course.
Okay.
Oh, I mean, I think that whenever anyone has a surgery, and this is considered surgery, though this is a minor surgery, this is considered like a minor gynecologic surgery. The only thing is the entry point of the needle vaginally with ultrasound guidance, as opposed to cutting somebody open or across or putting in ports with holes and tubes like laparoscopy. So this is minimally invasive surgery. But any surgery has four main risks, and that's bleeding, infection, anesthesia, and like the area that you're working on, whatever type of surgery you're doing, the surrounding anatomy could be affected, whether it's a blood vessel or another organ. So the bowel and bladder are kind of near the ovary. And so obviously we want to steer clear from that. And blood vessels are nearby too. Any of those four risks are like less than 1% of the time those things happen. So most of the post-op recovery period and things to look out for are anything that would point to one of those four possible things. So besides, again, verbally being explained this and written information, the main things are like, obviously, if your pain's not controlled, if you're feeling significantly lightheaded, dizzy, or passing out, if you spike a fever, if you have increasing tenderness in your abdomen. So if you're bleeding more than expected, you should really just spot after the procedure. You shouldn't really be having like a full-blown heavy period by any means. So these would be like the obvious ones. But then there's also the ovarian hyperstimulation, which you had mentioned, like having lots of liquids and resting and having, more concentrated protein, either broths or electrolyte solutions. So for hyperstimulation, the one that I talked about when people get really bloated and their belly sticks out and there's lots of fluid around, we want that fluid to come back into the vessels. And so there's certain diet modifications like high protein, low carbohydrate, high electrolyte based diets that help with a lot of the symptomatology of that, though that will completely go away by itself and have no long-term sequelae. And also the four things that I mentioned that are very low risk of happening would, depending on how they present themselves, are things that likely you're not only not going to experience, but if you do, there's a quick management strategy to help with any one of those potential complications.
Amazing. I love that. Thank you so much. And I will actually chime in here about the question of when to come in for acupuncture after a retrieval session. So the data points to not the day of, but 1 to 2 days after the surgery. If you feel like you can make it into the clinic, this is an absolutely amazing post-operative treat that you can give to yourself. At our clinic, we can do things like red light therapy that can be really helpful to mitigate pain and swelling. And then also we have point selection that can manage what we call manage water passages, which would help with that interstitial fluid that you might be experiencing, things like that. And then obviously, acupuncture is really helpful for just generally calming the nervous system. I know for some of our patients that we share together, it's like this is a really arduous time in the sense that there's a lot of anticipation. There's a lot of stress and anxiety around how many of those embryos, if you are making embryos, are going to be viable, what PGTA testing is going to look like. And so acupuncture can really be a wonderful support system for that time too.
Fully support you saying that. I have noticed that whatever exactly is happening in the stimulation phase and then during the actual procedure, but mostly in the post-op period, that my patients that are taking advantage of acupuncture have a very nice, smooth sailing experience throughout, like with either pain tolerance emotional tolerance of the procedure. And I do really support our patients working together in that way.
For sure. And like one thing I also want to touch upon when at the top of this interview that you talked about was like knowing exactly what's going to happen at RSA Surgery Center. By the way, shameless plug here, their RSA Surgery Center is like the best in LA. I swear to God, it's like my favorite place to go. Um, and I know all the nurses and staff there, and they're lovely people. But things to think about, right? Like really prepare, and like this video is going to be so helpful for people because like knowing what to expect that day, and like it takes a lot of the fear of the unknown around it, right? Are there things that you tell your patients besides that knowledge that you just imparted about like the couple of days before the retrieval? Are there things that you ask them to prep for? Like, are there things that you want them to do for those couple of days before the retrieval so that they can be really ready for the surgery?
Um, we tell them so much stuff. There is so
I know,
many
I know.
things that they have to follow to get spot on, specifically their trigger time.
Yeah.
Right now I'm not the first call when people are after hours, but any fellow in our field or any, doctor that's on call always gets that I don't have my trigger injection phone call
Oh
uh,
my God.
the night because these shots are given like 34 to 30 hours before the egg retrieval, which is notoriously after hours where every pharmacy's closed. And that's always it's a very important shot. And without it, no eggs are coming out. And so, one thing I tell people that's prepping for their retrieval is on this day, this is trigger day, go home now, open every single box, look at every single needle, rehearse your steps while we're still in the office so that there's no surprises when you open your box. You'd be surprised how many times I've gotten the call. I opened their box and there was nothing in it. I don't that happens, but it does. And I mean, I even remember a Halloween, I spent an entire Halloween calling every single CVS pharmacy. A lot of these drugs you cannot get at just routine pharmacies. These are specialty drugs. And so just being super prepared with the final instructions would be, I guess, one thing. The other thing, if they have a male partner and the partner's going to be producing a sample, I like the partners to be involved as much as possible beyond helping the patient through the cycle and maybe giving the medications. They have a very important job and role, even though they're not the ones primarily being poked and prodded. But it's really good to ejaculate regularly while the woman's going through her stimulation so that when we get the sperm, it's like the freshest sample that we could get. Newer data even says that men should be ejaculating. I may have said this in something else we did, 4 hours, which is a little unrealistic, but depending on the time of retrieval, 4 hours before the actual egg retrieval. So I am having my men, depending on their sperm count, of course, and speak to your provider about this one, but ejaculating at least every other day in cycle or the day before the egg retrieval just to keep the sperm fresh. And so like those are some practical things I guess I would tell people. I do try to give them a foreshadowing of what to expect post-op. And if I think they're going to be at risk for ovarian hyperstimulation, I already give them a printout of what to eat and drink and how to sleep. For example, patients with OHSS that are accumulating fluid and getting so bloated could get very short of breath. So like they should sleep propped up at a 45-degree angle, and they should be monitoring their weight every day just to see how much they're accumulating. Again, luckily, I rarely see hyperstimulation these days, but I used to. So that's something I tell people. But mostly it's wonderful. And this is where you could chime in, just having a really good night's sleep as best as you can the night before the retrieval. A lot of people end up having having a hard time sleeping or just like their mind's very, very active. So I feel like the more, like I said, I could walk them through their day, the more calm they are, the more they could sleep. And if not, I tell them the anesthesia is the very best part. And as much as people are scared about it, it's always their favorite part of the journey to have a controlled drug journey.
I love
So,
that. I love that. That was a great answer. And I will say this in regards to the sleep prep. That is a whole section that like a fertility acupuncturist will work with somebody just as a ramp up kind of exercise to this retrieval, because this really is like akin to running a marathon, right? So there's these like tiny little steps that a fertility acupuncturist will take you through, so that you are ready for this final marathon thing. And one of the things that we start with right away, like about 3 to 4 weeks before a retrieval, is that sleep hygiene piece, right? So we work on incorporating certain acupuncture points and protocols to work on a restful sleep and working on improving that sleep, teaching them about blue light glasses, and then using command points with things, very simple things like lavender oil behind the ear on the command points, and making sure that sleep is a ritual, right? So you are already conditioned to a better sleep cycle, which is going to improve your healing times and your post op recovery as well. So I love that we just talked about sleep a little bit because it's massively hard to get a great sleep hygiene protocol in place, right? So it's nice that we kind of talked about that. Thank you.
Think that there are some really basics in life that the way the world works today, we just completely forget about. That's like however you're gonna feed your body, when you're gonna feed your body, and how much you're gonna feed your body, what kind of combinations of food you put together, and then combine that with
Yeah.
how you're going to hydrate your body that maybe a million years ago seemed really basic and structured. Today, people aren't as structured. And I think sleep is one of those as well, especially with this constant lights flashing in our faces and all this technology. We don't realize how much we're all actually sleep deprived. And even like having regular bowel function is a big one. So I think the combination of acupuncture and then all these like medications we're giving our patients and procedures to go through, if you're not coming into your procedure without having a well established system working in your body of those three basics, it well, I'll say it in a positive way. If those three things could be optimized in some capacity or some energy and focus could be put towards that part of your wellness journey, then your performance throughout our cycle and then your overall outcome, I feel, will definitely be better, at least physically feel better and psychologically feel better for you. And that's one of the key parts where I think our worlds collide because I think you're so good at nourishing just the wholesome body. And then that optimal space makes our work smoother and easier. And people tend to have just a much better journey through it.